Ladies and gentlemen, good morning and welcome to our 7th webinar. Now you may be wondering, why have we selected the topic post-COVID diabetes management? The answer is very simple. 10% of the global population is diabetic, and that accounts for 400 million people worldwide. Let us look at the pandemic, the COVID pandemic. This accounts for 178 million people. Now, this is a large population. What happens when these two populations mingle? You have what is known as the perfect storm. 30% of long COVID patients are diabetic. And that is the reason why we are having this seminar today. We have an extremely experienced medical professional who is our first speaker. We have Dr. Hala Yusuf Hamdi. Now, Dr. Hala has more than 30 years of experience. She's a head of endocrinology in RAC hospitals. And prior to that, she worked in Egypt, Kuwait, and we are currently honored to have her amongst our medical professionals. Now, Dr. Hala doesn't only deal with diabetes. In her vast range of experience and expertise in endocrinology, she touches upon all the diabetic comorbidities, and that includes hypertension, dyslipidemia, and obesity. Besides that, the management of thyroid disorders, pituitary disorders, adrenal disorders, and even polycystic ovarian syndrome. Friends, we sit at the feet of Dr. Hala and learn about the correlation between the current pandemic, COVID, and diabetes. Dr. Hala.
Good afternoon, everyone.
Good morning, Dr. Hala.
Good morning, sir. Thank you very much for your kind words. Thank you. Okay. We speak today, as the professor said, about the COVID-19 and the diabetic management. COVID-19 is caused by the coronavirus. So it is a virus. So it is like seasonal flu? No, of course, all of us knows it's serious complications and what we are facing now with this virus.
Ronnie.
So there isn't enough data now whether people with diabetes are more likely to get COVID than the general population. But as we know, the general prevalence of diabetes is at about 30%. So if 100% becomes infected with COVID, at least 30 of them will have diabetes. Diabetics face worse complications. That it means they have more serious complications. People with comorbid conditions, with diabetes, like hypertension, heart disease, or kidney disease, have a higher risk of getting serious complications with these infections. Older people also at higher risk of complications. So people with diabetes appear to be at increased risk of having a more severe COVID-19 infection. Though evidence quantifying the increased risk is highly uncertain up to now, the extent to which clinical and demographic factors moderate the relationship between diabetes and COVID-19 severity is entirely unclear due to the paucity of data. The certain link, and now the data strengthened the link between obesity and severe COVID. Hundreds and thousands of deaths worldwide from COVID could have been avoided if obesity rates were lower. This is a new report. We define obesity as the BMI is more than 30. So how can we calculate this BMI, which is we get the weight in kilogram and over it the square of our length in meters. Above 30 is considered obese. An analysis by the World Obesity Federation found that of the 2.5 million COVID-19 deaths reported by the end of February 2021, almost 90%, 2.2 million, were in countries where more than half the population is classified as overweight. The report released to coincide with the World Obesity Day calls for obesity to be recognized as a disease in its own right around the world, and for people with obesity to be included in priority lists for COVID-19 testing and vaccination. And we shouldn't forget that obesity is a risk factor also for developing type 2 diabetes.
Doc, can you share the slides? We are not able to see your slides. Yes,
Now
Doc, we can see now.
Okay.
Yeah, we can see now. You can continue with the current slide, what you're talking about.
Okay. So as we said, the people with diabetes are more likely to have serious complications from COVID-19. Well, if that our diabetes is controlled and the blood sugar is our target, this reduces the risk of getting complications from the viral infection. As we know, any viral infection can cause inflammation in people with diabetes. And this is also inflammation is more if the sugar is above target. And this inflammation also contributes to the more severe complications. So for people living with diabetes, it is important to take precautions from getting the virus infection as any people. Pardon?
Bro, no, bro.
Yeah, ma'am, you can continue. You can continue. Please, other participants, I request to mute your mic, please.
Wash hands thoroughly and regularly. Try to avoid touching your face before washing and drying your hands. Clean and disinfect any object or surfaces that are touched frequently. Try to avoid contact with anyone showing symptoms like coughing. Try to avoid large gatherings. And if you are ill with flu-like symptoms, Stay at home. Pay extra attention to your glucose control. And this is by taking your medication regularly, not to stop them. Also, to live a healthy life. Regular monitoring can help avoid complications caused by high or low blood sugar. If you do show flu-like symptoms, raised temperature, cough, difficult breathing, it is important to consult your healthcare professional. Any infection, whatever it is going to raise your glucose levels and increase your need for fluids. So make sure you can access a sufficient supply of water. Make sure you have a good supply of your diabetic medications you need. Think of what you would need if you had to quarantine yourself for a few weeks. Make sure you have access to enough food, not any food, but healthy food, more vegetables, less fats, less carbs. Keep a regular schedule, avoiding overwork and having a good night's sleep. As we all know, high blood glucose causing thirst, dry mouth, passing large amounts of urine, which leads to dehydration. And this is the importance of taking excess water and enough water supply. Weight loss. Our warning symptoms: fever, chills, cough, shortness of breath, fatigue, muscle and body aches, headache, new lost taste or smell, nausea, vomiting, diarrhea. So if you feel that you are developing symptoms of COVID, you have to call your doctor. And when you call him, you have to have your glucose readings and your ketones in urine if your blood sugar is more than 250 milligram per deciliter. Keep track of your fluid consumption. Use a 1 liter bottle to indicate how much fluids you have been taking. Be clear on your symptoms. The key opportunities to transform type 2 diabetes care post-COVID is to prevention of type 2, induction of type 2 diabetes remission, effective treatment to prevent the complications, effective monitoring to detect and treat the complications, safe care during hospital admission. It is now clear that the epidemic of overweight and obesity that have got more than doubling rates of type 2 diabetes of the last 2 decades has been compounded by excess deaths due to COVID-19. So now more than ever is the time required to improve the diet and to tackle this obesity epidemic. Lifestyle is very important in this group of people, which they have to take care of themselves. It has recently been shown that type 2 can, in up to half of the cases, be reversed in primary care during its early years using a supported low-calorie diet. Yes, it can get it into remission, but you have to understand that if you return back your high-calorie diet, it will relapse again. So you have to be on the low-calorie diet so that you will not have another relapse of the type 2 diabetes. Effective treatment to prevent complications is mandatory. And the last 5 years have been unprecedented for pharmacological innovation in type 2 diabetes. There are 2 new classes for the first time reliably reduce the weight and prevent heart disease and stroke, and also decrease the kidney diseases and the microalbuminuria and complications of kidney. However, many individuals with the conditions are not prescribed these modern and cost-effective therapies. Important barriers include the expertise in the use of these newer agents residing mainly in secondary care, and also they are still expensive for many people. We are caring for type 2 diabetes to reduce their complications. So monitoring of these conditions involves regular, at least annual review, checkup of your blood pressure, of your weight measurements, of your waist circumference, of the HbA1c. This is the glycated hemoglobin. It tells us about your previous 3 months. How is your average sugar? How is average glucose in the blood? Is it well controlled, or you need more intensifying of treatment? Cholesterol. Cholesterol is a risk factor for cardiovascular disease. And cardiovascular disease means the heart attacks, the strokes. So we have to control it. And they have a target in the low density lipoprotein, which we call it the bad cholesterol. Retinal screening is mandatory for diabetic patients. As we know, blindness is the most important now cause of blindness worldwide is diabetes. Food screening, it is very important. We are always telling the patient with diabetic, and especially who are peripheral neuropathy, to look to their food by a mirror because they will not feel. I have one patient who have a severe peripheral neuropathy. He walks on a in summer on hot surface, and he had 2nd-degree burns on his food, and he didn't feel it. So food screening and advising the patient to take care of their food, to go to the podiatrist is very important. Albuminuria screening is important so that we detect if any kidney affection had happened and to tackle it as early as possible. Our key points in this speech: that people with diabetes developing COVID, yes, they are at increased risk for complications and mortality. But adherence to healthy diet and lifestyle is very important. General precautions to prevent COVID-19 infection are critical for people with diabetes and their families. People with multiple comorbidities, as heart disease, as hypertension, as a strokes, as kidney disease, need extra caution. Continuation of the good dietary practices, safe physical activities, and regularly should be encouraged. Measures such as telemedicine services or drugs dispensed for extended durations should be adopted to reduce the exposure of diabetic patients to infections. People with diabetes who develop COVID-19 infection should continue their routine medications unless the illness is severe. For severe COVID in diabetic patients, glycemic control is best achieved with insulin, and this will be in the hospital because it is a severe condition. For severe COVID infections, the warning signs are that there is severe breathlessness and chest pain, bluish lips or tongue, or they have confusion, or they want to sleep and they cannot raise up from sleeping. At this moment, they have to go to the hospital immediately. Sodium glucose transporter 2, which is a group of classes of the anti-diabetic medication, are best discontinued unless the illness is mild. Research into pharmacological therapies for treatment and prevention of COVID-19 in people with diabetes is urgently needed. Thank you.
Dr. Hala, thank you so much. Thank you so much. Thank you so much. The advice that you have given is all conclusive, all comprehensive. You have spoken about diet and lifestyle. You've advised us to manage our blood pressure, cholesterol, weight, to check our HbA1c, to have a retinal screening, to visit a podiatrist, and so on and so forth. And it is so relevant because from my reading, I understand that 70% of diabetics survive COVID.
Yeah.
And that is the good news. The good news is that your advice will reach these 70% and will increase the numbers of survivors. Thank you so much, Dr. Hala. We are so grateful.
Thank you, sir.
Our second speaker today, who will be talking about lifestyle therapy. Now, Dr. Hala did mention diet and lifestyle in her talk as one of the great preventive steps. And we have an eminent speaker, Dr. Harikat Wilku. Now, Dr. Wilku is certified by the American Council of Lifestyle Medicine. He is also certified by the American Council of Preventive Medicine. And in addition, he is a certified corporate wellness specialist. Beyond all of this, he is a certified homeopathic physician. Now, he has more than 2 decades of clinical practice in homeopathy as well as corporate wellness. And as proof of that, he has directly associated with more than 65,000 corporate employees and more than 10,000 school children. He has met each one of these individuals and counseled them. He is an avid teacher. He has conducted more than 2,600 talks. And remember that in each talk, there are more than 50 or 60 people sitting in. His range of topics include chronic disease management, dependency management, cardiac care, occupational health, and so on and so forth. He's a faculty at the Apollo Hospitals Education Research Foundation. He teaches, in addition, at the RAC Medical College next door. His subject, postgraduate diploma in wellness management, the postgraduate diploma in lifestyle medicine, and preventive and promotive healthcare. Ladies and gentlemen, I present to you Dr. Wilku.
Thank you, Professor Kennedy, for kind introduction. Thank you, Dr. Hala, for your wonderful session explaining point to point. Many of the things you have already mentioned, it makes my work easy. So let's start. Okay. Is my screen visible?
Yes, Dr. Wilku, we can see your screen.
Fine. So I will put it on show. Yeah, hope I'm clearly audible and my slides are visible.
Yes, sir.
Welcome, friends. Today we are talking about post-COVID diabetes management. As you know, this is not only for post-COVID situation. The general management, diabetes management, includes people who are already existing with diabetes problems. They are pre-diabetics, they have a family history of diabetes, they are obese, or they have some comorbid conditions like hypertension, dyslipidemia, and other things. So this complete lifestyle management for diabetes will be very useful for everyone. So we call it diabetes. Why we call it diabetes? Because diabetes is managed. It don't go completely. So if you have diagnosed with diabetes, if you are on medication, you can manage it well with medication as well as lifestyle management. So when we talk about lifestyle management, there are certain factors. But when we talk about this certain factors, what I'm talking in general, because I'm talking to individual, not individual, as a mass we are talking. So when we talk individually for diabetes management, we call it lifestyle medicine because we are using the lifestyle to treat the disease. Now, first we will talk about what are the golden rules, the rule of hexagon. Check your health regularly. If you are diabetic, if you are on medication, if you are pre-diabetic, if you have family history, if you are obese, if you have comorbid conditions like hypertension and dyslipidemia I already mentioned. So you should be regularly doing your health checkup. Second, the diabetic diet. Diabetic diet is specific diet which helps to control your diabetes, manage your diabetes. Then comes exercise in relation to diabetes. Everyone knows exercise is a very good tool to manage your health. But when we talk about diabetes, it's very different. So we have to specifically follow a diabetic diet. Next comes manage your mind, means your stress, your emotions. We will link to every chapters what we are discussing. We will be talking about all these things. If you have any health habits like smoking, drinking alcohol, so we would rather suggest either control or quit or limit your things. One minute, please. It's not going. One minute, please. I will just reshare, please. And that's it. It was, I was showing it in slideshow. Just check.
Dr. Wilku, we can see your screen now.
Okay, thank you, sir.
We can see your screen.
Yep. One minute. Yeah, now you can see it very clearly, right?
Yes.
So we were talking about smoking and alcohol. So if you have any habits of smoking, oral tobacco or alcohol, either you should quit or limit it. Last not the least, foot care, very important tool for a diabetes management, especially chronic diabetes or uncontrolled diabetes. Let's start. Why we called it diabetes? Because we want to beat diabetes. We are living with diabetes. Those people who are already infected, existing diabetes, they should beat, manage. So what does this beat means? B means be physically active. That means do a regular exercise. E stands for eat hypoglycemic diet, means control your calories and eat low glycemic index food. We will talk all about. Then ABCs. Dr. Hala has already mentioned about ABCs. Always know and control your glycated hemoglobin, that is HbA1c, your blood pressure, your lipids, and control or limit your smoking. Track your glucose level and medication regularly. So let's start with the first tool for diabetic management. So diabetic management, when we are talking about diabetic management, we say diabetes management diet has different components into it. First, macronutrients and micronutrients. What are these macro and micronutrients? Macronutrients are the vitamins which are very essential for diabetes management. Everyone knows vitamins are very important for your health, But specifically when we are talking about diabetes, we should be focusing on few of the vitamins which are very important, like tocopherols. What is tocopherol? Vitamin E. What does it do? It helps. It's a very strong antioxidant, helps in cell repair, prevents cell degeneration. What is a good source? Nuts, seeds, soya beans, then sesame seeds, wheat germ. These are very good examples for vitamin E. Then comes to cobalamin. What is cobalamin? Vitamin B12. What is B12 doing? It helps in RBC, red blood cells formation, where hemoglobin is carrying the oxygen. So it helps to produce RBC. It helps in neurotransmission also. So what is a good source for B12? Organ meats, fish like tuna, sardines, trout. These are good fishes. Then red meat, lean red meat. Then fortified cereals. Next important vitamin is pyridoxine, vitamin B6. What does it do? It helps in RBC formation and prevent anemia. What is the good source for pyridoxine? Chicken, fish, peanuts, soya beans, banana. Last but not the least, very important vitamin is ascorbic acid. What is that? Vitamin C, which helps in cell growth and repair. Overall repair and cell growth it does. What is a good source? Everyone knows. Citrus fruit like oranges, grapefruit, strawberry, black currants, broccoli, Brussels sprouts, and peppers. Then comes to micronutrients. What are the micronutrients? Micronutrients are minerals which are used in less quantity but very essential for many functions. Our body requires a lot of minerals, but especially two minerals which are very important for diabetic management. One is magnesium, second is chromium. What does magnesium does? Magnesium helps in metabolism, neurotransmission. It works as an anti-inflammatory and also works as mood regulation. Now, what does chromium does? Chromium promotes insulin sensitivity, which is very important because once your insulin is produced, if your cells are not sensitive to accept insulin, it will not work. So chromium is very helpful in increasing the insulin sensitivity. What are the good sources for both? Pumpkin seeds, almond, peanut, black beans, avocado, kidney beans, yogurt, broccoli, wheat germ, and many more. So next come to enzymes. What are the important enzymes we use for it? Glucokinase, carnitine, and biotin. These are very important enzymes which work very efficiently for diabetes management. What is glucokinase? It's an enzyme which is present in liver and beta cells of pancreas. Most of you know insulin is produced from beta cells of pancreas. So it is very important that you must have a good level of glucokinase. Then glucokinase is also promoting the sensor. It's a sensor, regulates a glucose pathway in absorption and utilization, as well as insulin production. Then comes carnitine. Carnitine helps to regulate the energy. Whatever we eat, the energy is taken from the calories what we are eating, and that energy is being utilized by the help of carnitine. Also helps production of energy from the fatty acid. The stored fat, the unused calories which are stored as fat in usable times. Last comes biotin. What is biotin? It works as metabolism pathway for gluconeogenesis. What is gluconeogenesis? Production of insulin other than carbohydrate source, means fat, protein, whatever other sources we consume. From that source, it produces glucose. So biotin helps in that, especially from fatty acids. When we eat some food, the calories we eat are used, but unused calories are stored. for time of emergency. That is stored as fat. Now, last comes the polyphenols. What are polyphenols? These are strong antioxidants. It helps the proper utilization of all minerals, vitamins, or all enzymes and hormones. It helps as antioxidant, works as proper utilization of that. Then second component comes about the diet and calories. Again, there are 4 enzymes which work very strongly when we are talking about specifically diabetes management and obesity management. Leptin. What is leptin? Leptin is a hormone which regulates the body fat. If you have reduced leptin, it causes uncontrolled hunger. Means leads to overeating. Also regulates your energy expenditure. So you should be very careful about the leptin. I will talk about how to do that. Then comes ghrelin. Ghrelin is also an enzyme, hormonal enzyme, which regulates your hunger. Your food intake works almost similar like leptin, but little bit difference. Increase protein intake in the morning. If you are eating some protein component food item in breakfast, your ghrelin level is high, which helps to control your hunger, which improves your metabolism. Then comes cortisol. Cortisol is very important because it regulates your stress and mood. Increased cortisol levels reduces your enzymes, minerals, vitamins, absorption and utilization. Means reduced cortisol increases your stress. When there is high stress, your leptin and ghrelin will not work properly. Means you will be feeling very hungry. You will be eating a lot of food. You might know in high stress, people used to do that. Then comes neuropeptide. What is neuropeptide? Neuropeptide is a glucose produced from brain cell. Hormone which is produced by brain cells. It stimulates the appetite. Again, when we are talking about appetite, the leptin and ghrelin is controlled by neuropeptide. But neuropeptide also works for stress management. Now, what are the good foods? If you see, initially when I was talking about the macro and micronutrients, I was talking about broccoli, I was talking about this oranges and sesame seeds, salmons, nuts and seeds, kidney beans, all are functioning for your tocopherol, cobalamin, means micro and macronutrients. It supplements with that. It helps to promote your leptin, ghrelin, and cortisol and neuropeptide levels. So these are the superfoods for diabetic management. Then comes simple and complex carbohydrate. What is simple carbohydrate? Means easy source of glucose. Say for an example, simple sugar. Simple sugar is a simple glucose producing food. So you have to be very careful of taking, avoiding simple, going towards more complex. What is complex carbohydrate? Which still gives you glucose, but in a slow release, like whole grain wheat and vegetable carbohydrates. These things are complex carbohydrate. Now comes starchy and non-starchy food. What is starchy food? A simple layman's understanding. Any food which becomes sticky is starchy. Which doesn't become starchy, which is not sticky, is non-starchy. That's why you might have heard when a person suffers from diabetes, doctor used to say avoid white rice and go for wheat, whole wheat chapatis or anything like that. Why we say both are source of carbohydrate? Simple thing, white rice gives you starchy thing. It releases the glucose immediately into the blood. Whereas whole wheat grain, these are releasing glucose slowly so that your spike is not very high. Then comes the superfoods. I've already mentioned about all the superfoods, so you should be following. Last, not the least, rules of nutrition. What is rules of nutrition? 3 rules of nutrition are there. glycemic index versus glycemic load. Means whatever we are eating should not spike your glucose level immediately. What is glycemic index? The sweet index, which gives your spike in the glucose level. And what is glycemic load? Whatever we eat, the carbohydrate or whatever we eat, that gives a load or amount of calories in the blood from where the glucose has been taken off. So you should be more focusing on glycemic load rather than glycemic index. Yeah, if you are doing a very intensive exercise and if you are dehydrated, if you are feeling very low, your sugar level goes down, you should be taking about food which is high in glycemic index immediately to spike your glucose level to normal. In and out. In and out is simply understanding whatever we eat, means what calorie we eat, we should burn it. If we don't burn the consumed calorie, it will be stored into fat for an emergency use. So better in diabetes management, whatever we eat should be burnt out. Last, fat and fiber. What is fat and fiber? We should always use unsaturated fat. Means what is unsaturated fat? Any fat or oil which remains liquid in room temperature. We should always prefer these. We should avoid saturated fat. When we are taking fat, we should compensate it with the amount of fibers. How we are getting fibers? Whole wheat grain or vegetables, leafy vegetables we should be eating. Raw vegetables as a raw salad we should be eating. Next slide will be giving you health tip covering everything. The dietary tip for diabetes management is simple. If you follow two diet patterns, DASH and hypoglycemic. What is DASH? Dietary approach to stop hypertension. And hypoglycemic means any food which is low in glycemic index. So you might notice we are talking about diabetes management, but we are talking about DASH diet. We already said comorbid conditions like hypertension and dyslipidemia leads to diabetes problems. So we should be following all these things. So what are these tips? Increase one daily serving of vegetables, especially the leafy vegetables every day. Increase 1 or 2 servings of fruit or raw salad. Salad should be raw, not cooked, so that your minerals and vitamins are intact and fibers are still present. Inclusion of nuts, seeds and beans. We have already mentioned why we require this. We get a lot of omega-3 from them. We get minerals from them. We get vitamins from them. So your leptin and renin levels are all maintained by these nuts, seeds and beans. Decrease starchy food. I've already mentioned about that. Decrease saturated oil and saturated fat. Decrease fruit juices. In fruit juice, we always consider to eat fruit, not to drink a fruit. For diabetes management, simple rule: eat a fruit, don't drink a fruit. Why we are saying if you prepare a juice of the same fruit which you are eating, the glycemic index increases because there is change in the chemical combination, fibers are lost, so the sweet index increases. And I've already mentioned the sweet index, the high glycemic index will spike your glucose level in your blood. Decrease your carbonated drinks. Why we are talking about carbonated drinks? Any fizzy carbonated drinks should be avoided because it erodes, degenerates your mucosal membrane in the digestive tract, which are very helpful for absorption, some vitamin absorption, vitamin production. These are very important. So decrease carbonated drinks. Decrease salt intake, especially when we are talking about processed food. Avoid processed food. Suppose if you love to eat something which is not available in the season, if you are going for a processed food, wash it properly so that the sodium content are less. Next, come to exercise. Again, a very strong tool for diabetes management. Before going into an exercise regime should be always approved by your medical professional, the treating physician. Get an approval that you can do exercise, what type of exercise you can do. Then go for a physiotherapist or a health coach who can tell you these are the things you should do. Basically understanding what we are saying, your exercise regime should always include three components: stamina, strength, and stretching. What is stamina? Any exercise which increases your endurance. Why we are talking about endurance is here? Stamina, 60% of your exercise regime should be stamina exercise, so that your calories consumed are burnt out. When you increase your stamina, when you work for your endurance, your calories are burnt out. What are good stamina exercises? There are a lot. Simple: cycling, running, jog, run, walking, brisk walking, swimming, squash playing. There are a lot of stamina exercises, but you should be very aware that what exactly you are going to do. If you have any comorbid conditions like osteoarthritis or joint pains, any arthritic pains, or if you have some cardiac ailments, you should take an approval. You should be combining your exercise and doing proper exercise. That's why we say before going into exercise regime, you should consult your physician, take a proper regime from your fitness coach or health coach or a physiotherapist. The physiotherapist will be the best to guide you. Then comes the strength exercise. 30% of your exercise regime should be strength. What are these? Sit-ups, push-ups, squats, dumbbell exercise, lightweight training programs. Why this is required? This is not to burn your calories. This is to strengthen your muscles, which are weakened in case of diabetes. So strength exercise is also very important. Then comes stretching. Why stretching exercise? Stretching exercise is meant for flexibility of your joints, because already Dr. Hala has already mentioned, and we know in diabetes there are disturbances in the enzymes and vitamins and minerals, which lead towards, and high stress also, so which leads towards inflammatory conditions. What is the main location for inflammatory impact? Are the joints. If your joints are inflamed, you will be having less range of motion. You will be having difficulty in mobility. So stretching exercises and mobility exercises are very important, which should be at least 10% of this. Now, in stretching exercises, you can go either mobility exercises taught by your physiotherapist, or you can do simple yoga exercises. Then comes a fit formula. When a health coach or when a health professional, fitness coach designs your exercise regime, he works for a formula. He works on a formula that is known as FIT formula. What is FIT? Frequency, intensity, time, and type. What is frequency? Means how frequently you are doing your exercise. Are you doing it daily, or you're doing it weekly, or once in a month? It depends. How much energy, the intensity you are working on your exercise. Like I mentioned, 60% of your exercise should be stamina exercise, because we are focusing in burning your calories. That is the major factor. So intensity has to be worked on it. Time means the duration of the time. The time can be in two parts: what time you should do exercise and how much time you should do exercise. What time? Any time for exercise is okay. When we are talking about diabetes and obesity management, any time is good. But you should not go in scorching sun, like in Gulf countries, UAE, it's very hot outside, it's dry. So, and even in the coastal areas, the humidity is very high. So dehydration is more. So be careful about the timing. So better, that's why it's a simple understanding. Either early morning or late evening exercises are good. Now, what type of exercise? I've already mentioned. If you have any comorbid conditions, you should be knowing what exactly exercise regime you should follow, either stamina, strength, stretching, or mobility, or flexibility, or you are doing yoga, whatever the type of exercise you should be doing. This 4 components should be followed always to maintain your exercise regime. Then comes the training heart zone. This is very important. You might have noticed many people, those who are obese, or maybe they have high diabetes, when they go to a doctor, they say, "Doctor, I'm following your advice of doing walking every day for 1 hour, but my sugar level is not coming down, or even my weight is not coming down." So there is some mistake. Definitely there is some mistake. Either you are not doing properly, or your doctor is not able to explain. Doctors are very busy, they will not be able to explain. you should consult your fitness coach or a physiotherapist for exact proportions of exercise. But general understanding. See, until unless your heart rate reaches a peak, a certain area, then only you will get the maximum benefit of your exercise, whatever exercise you are doing. So that heart rate is known as training heart zone or exercise heart rate, which is during your exercise. You can see a chart over there. In general, we are taking average of age between 40 to 45. The minimum heart rate should be 125 and maximum heart should go to 180. If you don't have any comorbid conditions like hypertension or any cardiac ailment or even thyromegaly, then it should be like this. For general understanding, every person has different training heart zone. It should be evaluated by your fitness coach. But for your understanding, heart rate between 150 to 130 is very good enough to do exercise and to get a benefit of your exercise. Last, the foot care. You might have noticed many people start generating symptoms of skin, very frequent recurrent fungal infections or any eruptions or any lesions in the skin which doesn't heal fast. Especially when we talk about foot care, why we are talking about foot care mainly, then it actually happens, your skin infection should be very controlled. You should be monitoring it very properly. You should trim your ingrowing nails. You should always monitor your corns and calluses, any formations. Change your socks if you have recurrent fungal infections. So don't walk barefoot. Use a proper fitted shoes. So this was my last slide. Thank you so much, Professor Kennedy, for your.
Thank you, Dr. Wilku. Thank you very much for your talk, and thank you for those dietary tips. Thank you for the exercises you suggested and your brief reference to foot care. Thank you so much. We now have a few questions which have been shown up on the screen, and I'm trying to read them out. We've received these questions. Well, I also have a list of those questions. The first one is from Harshraj Singh. Harshraj, I know Harshraj. He is currently studying somewhere in Europe. Okay, and Harshraj's question is for Dr. Hala. And it says, how does COVID increase post-diabetic complications? How does COVID increase post-diabetes complications? Dr. Hala.
Yeah. Well, up to now, it is our fear from the COVID and its complications. Okay, so the COVID, if the patient is diabetic and having complications, he has the serious complication of COVID. But up to now, known that the COVID will increase the complications of the diabetic unless it's affecting his heart or causing other or the kidneys. There are many people after COVID, their kidneys are affected. And they have, we found that they have higher creatinine and higher albuminuria. And this mostly caused by the dehydration which they face during COVID. And because of that, we are insisting on the to drink more supply of water. And also, there are many medications which are used in serious illness of COVID, which may affect the kidneys or the heart of the patient.
Thank you, Dr. Hala. Thank you so much. Now I am going down the series of questions, and I have a question from Suhaib Hussain. This question is directed at Dr. Wilku. It says, do exercises prevent diabetes? And what is the best exercise advised? This is a question for Dr. Wilku. Dr. Wilku, do exercises prevent diabetes? And what are the best exercises advised? This question is asked by Sohaib.
Yeah, thank you, Sohaib. Thank you, Professor Kennedy. Yes, definitely exercise helps to prevent and manage diabetes. Just now we were talking about the components of exercise. I have emphasized 60% of your exercise should be stamina exercises. Means brisk walking, cycling, walk, jog, swimming, playing squash. These are very important exercises to burn your calories. Means, in other words, to maintain your blood glucose levels. Either to prevent, if you are not diabetic, if you have family history, or if you have obesity, or you are going to be pre-diabetic, this will help you to prevent from it. And suppose if you are suffering from diabetes, it will help you to manage it.
Thank you. Thank you, Dr. Wilku. I see a question over there from Ritesh Gupta, and he asks a question which I'd like to direct to Dr. Hala. And it says, is insomnia a post-COVID fallout? Meaning, do long-haul COVID sufferers frequently suffer from insomnia? Dr. Hala, if you can give us your thoughts on this.
Yes, we found that many people in the post-COVID have insomnia, and we don't know what is the cause of this up till now.
Thank you, Dr. Hala, thank you. A question for Dr. Wilku, and it's from Francis. As I can see, it's from Francis. And it says, my father is 45 years old. He is overweight and on medication for cholesterol and blood pressure. Now, is he at risk for getting diabetes? Dr. Hala, if you don't mind answering this one. Here is a gentleman who's 45 years old and overweight, currently on medication for blood pressure and cholesterol. Is he at risk for diabetes?
Yes, he is, of course, have a risk for developing diabetes. Here he is overweight, plus he has cholesterol and blood pressure. And these are the risk factors for the metabolic syndrome. And the metabolic syndrome, they are more prone to develop diabetes.
Good. Thank you, Dr. Hala. Here is a question for Dr. Wilku. It doesn't appear on your screen, but I have it on a piece of paper in front of me. I don't quite know who has sent in this question, so I leave it as a general question. But the question is, I am obese. My BMI is 27.2. I have a feeling this gentleman or lady is talking about me, because that is exactly what my BMI is. Well, it says my BMI is 27.2. My father was diagnosed with diabetes at the age of 52. What should I do to prevent this? Now, I'm going to ask this question to Dr. Wilku. Dr. Wilku, here is a gentleman who is overweight, a young boy who is overweight. His father was diagnosed with diabetes at the age of 52. Are there any steps that this young boy can take to prevent getting diabetes?
Yes, Professor. See, we have already discussed, Dr. Hala has already mentioned, even me, I've already mentioned, if you have any comorbid conditions, you are very prone to. In comorbid conditions, we have also mentioned about obesity. Obesity as a comorbid condition. Your BMI is 27.2. That means you are obese, definitely. And you have a family history of your father getting diabetes, but still at age of 52. That means you are not carrying it as hereditary. Maybe it was hereditary. We don't know about that. But definitely this was due to lifestyle. So you are prone towards getting diabetes. So definitely you should be following a complete strict regime of diet as well as exercise. I would rather not say strict diet plan, but you should be counting your calories, what you are eating, rather to say that. Count your calories, what you eat, be specific on food. Don't be very fond of eating fast food and other things, and do a regular exercise. This will help you to prevent it.
Thank you, Dr. Wilku. Now, here is a question for Dr. Hala, and it comes from Hasraj, and it says, I have an itchy skin and my wounds take time to heal, but my blood sugar reading seems to be normal. Do I have a risk of diabetes? Here is a young boy whose wounds seem to take a little long to heal. His blood sugar seems to be normal. He asks, could he be at risk for diabetes? Dr. Hala, your wisdom, please.
Yeah, there is up to now no risk factors for the delay in wound healing. He should find another cause of this healing, whether vitamin C deficiency or other causes. As long as his blood sugar is normal and his HbA1c is normal, this is not a risk factor for developing. If he developed diabetes, yes, this is some of the complication of the skin itching and so on, but not as a risk factor for developing diabetes.
Dr. Hala, another quick question to you. It says, my mother has been diabetic for the last 15 years. Her diabetes is under control, but she feels very weak. She is also a post-COVID patient. So we have a lady who is diabetic, who has had COVID, and she feels very weak. Do you have any advice for her, Dr. Hala?
Well, as long as her blood sugar is controlled by the HbA1c and the blood sugar monitoring, and most probably this is what we call the post-COVID symptoms, which sometimes patients have some lethargy as any post-viral infection. Sometimes it lasts up to 6 months. She should take vitamins and consult her doctor for other causes. Otherwise, this will be the post-viral symptom of COVID.
Thank you. Bharat will be happy with that answer because he was the young boy who asked the question. I have a question here for Dr. Wilku. Now, I'd frame this question in 2 parts. The question is, does secondhand smoking cause diabetes? I would go further and ask the question to Dr. Wilku, is smoking a risk factor when it comes to diabetes? Dr. Wilku, your vast experience will help us with this answer, please.
Yeah, thank you, Professor. Definitely, smoking has impact on diabetes. We rather should not say that smoking causes diabetes, but definitely if you are pre-diabetic, if you are diabetic, it will increase the complications of diabetes. So smoking, and second part, what you are talking about, second-hand smoking. See, there are 2 aspects of smoking. Completely smoking dependency management is a vast subject. But for making it short, I will just simply say, still you are going to have cardiometabolic, like Dr. Hala was saying about metabolic syndrome. So in metabolic syndrome, there are a lot of factors which are taken care of. See, for an example, if I'm talking about hypertension. So smoking, whether you are smoking yourself, whether somebody else, and you are inhaling the smoke, that carbon dioxide and carbon monoxide which you are taking inside is causing increase in your blood pressure, heart rate, as well as friction of the vessels, which damages the vessel wall. So it will lead towards metabolic syndrome, and it will complicate the health. So sure, it complicates, it has a problem. Even the second-hand smoking or first-hand smoking.
Okay, thank you, Dr. Wilku. Dr. Hala, a quick question for you. We have an individual who is 28 years old, a BMI of 30.6. So this individual is certainly overweight. An individual who is 28 years with a BMI of 30.6 without any family history of diabetes. No family history of diabetes. But the individual also mentions that they feel weak and lethargic most of the time. The question asked is, with my BMI of 30.6, but without any family history, am I at risk to develop diabetes? Is the question asked by this individual.
Yeah. Obesity increases the risk of diabetes twice, even if there is no family history. So yes, he have an increased risk of being diabetic, and he should follow his condition, and also to find other causes of his fatigue, whether he has any thyroid problem or any other tissues with the hormones. But yes, he is at risk of developing diabetes, and he should control his weight better than this.
Thank you.
Professor, I will be adding one lifestyle aspect on it. Yeah, definitely. We, both of us, Dr. Hala and me, we have mentioned that obesity is one of the comorbid conditions for developing or complicating your diabetes. Generally, if you see the presentation which we have taken for lifestyle management for diabetes, theoretically, if you see, all of things can be followed for maintaining your weight. So obesity can be managed. If you manage your obesity, if you don't have any comorbid conditions or any reasons of obesity and lethargy, definitely it's like Dr. Hala said, it increases double the risk of getting diabetes. Thanks.
Thank you very much, Dr. Wilku. Thank you so much, Dr. Hala, not just for answering the questions, but for the great wisdom that you have both provided to this extremely important topic of diabetes management post-COVID. Thank you ever so much for your wisdom. Friends, I want to thank all our participants for logging into this program. Our apologies for the minor glitch that might have happened towards the beginning of this program. Now, I'd request you not simply to wait for the webinars that happen every 2 weeks, but to actually take advantage of our website by logging in. You have a poster on your screen. Log into www.rachospitalrehab.com and you will come to our website, which is promoted by the UNDRR ARISE, which is the UAE component of a UN body. Now, once you get to this website, you will get a lot of current information about long COVID situations. You will be able to take an individual scan, which will ask you questions about yourself, your comorbidities, and your symptoms, and give you an individual prescription. Now, that is the exciting part. This is perhaps one of the few products anywhere in the world that gives you a post-rehab individualized prescription. You will also notice that we present weekly tips. Now, these weekly tips present across the entire spectrum of COVID, and therefore it would not only talk about diet and exercise, it would also talk about anxiety and stress and depression. It would talk about working from home and so many other factors. But most important by far, it will give you the recording of every webinar that has happened in the past. So you will be able to see all the 6 webinars that are extremely knowledgeable, and this one will also go up within a few days. So once again, my gratitude to Dr. Wilku and Dr. Hala. My thanks to all my colleagues who have come in to sit in on this program. And I draw to your attention that our next webinar will be on the 3rd of July, Saturday, the 3rd of July. And the topic will be SARS-CoV-2, the vaccine, the myths and facts. And this is a burning topic across the world, a burning topic across the world. Should we vaccinate? What vaccinate should we take? How many times should we vaccinate? What are the benefits of vaccination? And so on and so forth. and we have an outstanding group of speakers to talk on this. Ladies and gentlemen, the 3rd of July, myths and facts, from myths to facts for the COVID vaccine. Thank you very much and have a great day.